Hello, my PureWick family. I am going live both here on Facebook as well as on YouTube. As usual, if you have any questions, please feel free to ask. We're going to talk about PureWick, which is a female incontinence product. I know not many people are talking about it or probably, hopefully not using it. But as a urologist, I do prescribe and recommend PureWick for my ladies who are incontinent of urine, and sometimes they're kind of stuck in the bed from physical debilitation, or maybe they're recovering from some sort of a injury and they can't get out of bed and they wet themselves. So PureWick is a way to avoid wetting the bed, wetting the underwear, and it's a really neat product by BD Bard. I recently learned of a couple of tips that I thought I'd share with you regarding the PureWick Female Catheter. So this is what the catheter looks like, and I'm going to just kind of take one out of here. So this is what the catheter looks like. This end gets connected to suction, and then you have this part right here. This is the part that is exposed to the female genitalia, the vulva, the part that you place between the vaginal lips. And this is the part that wicks the urine from the patient. And you think, this is such a simple device. How can you go wrong, right? Well, some of you have asked some questions regarding this thing and how to use it. So first of all, there is a tiny little opening right here. When you're using this device, when you're using the catheter, you do not want to plug at this opening. This apparently is by design so that it doesn't continuously clog up this area right here, and it doesn't collapse the entire catheter. So the engineers have designed it so that there's a kind of like a valve, not quite a valve, but a relief opening, if you will, because this is all pneumatic. It's all by suction. So make sure this is unplugged and not blocked as this catheter is placed on the vaginal area in between the labia, the vaginal lips. And this part goes into the perineum, or close to the buttock area. And this is towards the abdomen of the patient. And this part is facing the vaginal area. There's somebody else in the forum recently also asked, and I know a lot of you guys complained about the cost of the catheter, and some of you are reusing the catheter by taking apart this thing and washing this portion right here and then reassembling. Now, obviously that is not recommended by Bard, but if you are going to do it, as you are assembling this wicking portion back onto this tube, make sure you leave a little bit of space right here as you place this back inside this cover. And here's a hint. Here's a tip. Speaking of tip, get it? So if you press here, it should feel like you're pressing on the toe of your shoe. There should be no obstruction. There shouldn't be any tubing. You shouldn't feel any tubing by pressing this area right here. So if you are feeling this tube, if you're feeling this tube down here at the tip, you have inserted this tube too far. So let me see if I can show you. You do not want the tube to be sticking out like this. You want this tube to retract a little bit into the wick, and definitely you do not want to feel the tube down in this area. So during manufacturing, it should not be this far down towards the tip. There should be tubing here and all the way out here, but definitely not at the very tip. If it's at the very tip, it may render this area not as effective. So make sure that this is free from this tubing. All right? So very straightforward, very easy. And I know for a lot of you, placement has been kind of problematic, but you want to make sure that this part is facing the labia, and you want to spread open the labia and then place this facing the labia, because that's where urine comes out of. So imagine if you're facing the labia, you want to open up the vaginal lips, also known as the labia, and then place this directly facing that opening. And this part should be near the buttock cheek area, and this part goes to the belly towards the abdomen, and this part gets plugged into the suction. So very, very simple device. And when used appropriately, when positioned appropriately, it is a lifesaver for a lot of not just the patients, but also the caretakers of the patients, because often the patients are debilitated and your caretakers, your family members are taking care of the patients, and they're the ones who have to do the cleanup if this device is not appropriately applied and it's not effective. So if you're interested in learning more about PureWick, go ahead, if you're watching this on YouTube, go ahead and click on this link over here. And if you want more tips about the PureWick system, click on this link over here. I look forward to interacting with everyone. Take care. Bye-bye.